It's my pleasure to welcome you here for the annual Medicines New Zealand Parliamentary Dinner. At last year's dinner, several people spoke about the importance of getting together to jointly seek solutions to tough challenges in our health and disability sector, and I believe that is very true, and so thank you for bringing us here together to have this conversation.
It's been extraordinary to be part of the evolution of NICE over the years from an organisation that started, and I should say here, on the basis of looking around the world at the time for examples of how to approach the job that we had to do, including looking at the arrangements here in New Zealand. Arrangements had to be inclusive, so it wasn't something that we would do in a smoke-filled room amongst ourselves and suddenly launch a decision in the system. This was something that was going to take place in a public space and that would involve everybody who's affected by it, companies in developing the products, health professionals, patients and those who speak on their behalf, the health professionals who ultimately would have to execute the recommendations that we made.
Was that from the start that you resolved that this was going to be as open as possible?
Absolutely. The mandate that we got was that we had to set out our approach clearly. We needed to be inclusive, transparent and consultative.
The timeliness, I mean, you set deadlines both on NICE but also on the NHS, so when they have to deliver by.
We want to minimise the time that then flows to the point at which NICE produces its final guidance. Our target currently for cancer treatments is to issue final guidance within 90 days of the licence being granted. That's a target publication timeline that we're going to extend to all drugs over the next couple of years.
The challenge of innovation and adoption. Just take us through your thoughts on that, please.
Being faced with an extraordinary revolution in medicine, which is stressing health systems around the globe. We're going to have real problems with some of the really innovative new technologies that are challenging financially. They can be very disruptive to the care pathway inside the system. That means people changing what they do. There's going to have to be new approaches to sharing the risk associated with the uncertainties in terms of the effects of the new treatments that are coming through, and a sharing of the risk associated with the costs of those and the impact that that cost has on healthcare systems.